No more STD. All diseases that are mainly transmitted through sexual contact are generally called sexually transmitted diseases, or STDs for short. The statutory and monitored STDs in my country are syphilis, gonorrhea, non-gonococcal urethritis, cervicitis, condyloma acuminatum, genital herpes, chancroid, lymphogranuloma, venereum, and AIDS. This article only introduces 7 STDs other than AIDS. 1. Syphilis is a STD caused by Treponema pallidum, which can invade organs throughout the body and produce a variety of symptoms. But it can also be asymptomatic latent syphilis. Syphilis is mainly transmitted through sexual contact, and a very small number can be transmitted through contaminated daily utensils. Untreated pregnant women with syphilis can transmit the disease to the fetus through the placenta. The incubation period of syphilis is 2 to 4 weeks. The main symptoms of primary syphilis are chancre, ulcers in the genital area, and enlarged inguinal lymph nodes. Secondary syphilis causes skin and mucous membrane damage, and there may be a rash all over the body. In addition to skin and mucous membrane damage, tertiary syphilis can also cause damage to the cardiovascular, bone, joint, eye, and nervous systems. 2. Gonorrhea is a purulent infection of the urogenital system caused by gonococci. Under certain conditions, gonococci can also infect the eyes, pharynx, rectum, pelvic cavity, and some may have systemic infection. The incubation period is generally 2 to 10 days, with an average of 3 to 5 days. The most common urethritis in men is urethritis, with symptoms such as frequent urination, painful urination, redness, swelling and itching of the urethral opening, and purulent secretions. The most common cervicitis in women is cervicitis, which is manifested by increased and yellow vaginal secretions, leukorrhea, but many infected people do not have any conscious symptoms. 3. Non-gonococcal urethritis, cervicitis, is an infection of the urogenital system caused by pathogens such as chlamydia trachomatis and mycoplasma. The incubation period is an average of 1 to 3 weeks. Men have frequent urination, painful urination or a burning sensation, and the secretions are generally thin. There may be mucus secretions at the urethral opening when getting up in the morning. The symptoms in women are not obvious, and there may be symptoms such as increased vaginal secretions and lower abdominal discomfort. 4. Genital warts are a disease caused by human papillomavirus infection that mainly causes growths in the genital area. The average incubation period is 3 months. Initially, it is a soft, light red papule, which is a fleshy growth that can gradually increase in size. The surface proliferates in a granular manner and is rough and uneven, or merges with each other to form a cauliflower shape. It is mainly transmitted through sexual contact, and can also be transmitted through contaminated daily utensils. Genital warts grow rapidly during pregnancy. If they are not cured, they may be transmitted to newborns during delivery. 5. Genital herpes is mainly a sexually transmitted disease caused by herpes simplex virus. The incubation period is 2 to 20 days, with an average of 6 days. Initially, multiple papules, blisters or pustules appear in the genital area, followed by ulceration, erosion, and pain, which may be accompanied by systemic symptoms such as fever and headache. After the damage subsides, some patients may relapse after a certain period of time. It can relapse multiple times. Genital herpes is mainly transmitted through sexual contact, and a few can also be transmitted through contaminated daily utensils. Pregnant women can infect newborns during delivery. 6. Chancroid is a sexually transmitted disease caused by infection with Haemophilus ducreyi, and the incubation period is generally 2 to 5 days. Initially, it is one or several inflammatory papules or nodules in the genital area, surrounded by bright red erythema. After 1 to 2 days, pustules will form, followed by erosion and ulceration, and the lymph nodes will have obvious pain. It is mainly transmitted through sexual contact. 7. Lymphogranuloma venereum, also known as the 4th STD, is a sexually transmitted disease caused by chlamydia trachomatis L1, L2 or L3 serotypes, with an average incubation period of 7 to 10 days. Initially, it is a small blister or papule of 5 to 6 mm, which can form ulcers and unilateral inguinal lymph node enlargement. After a few weeks, the lymph nodes will rupture, discharge serous or pus, and form multiple fistulas, which usually heal in a few months, leaving scars. It is mainly transmitted through sexual contact.